Hi everyone, this is Scott Musersbaugh in the EOC. We wanted to put together a quick orientation for people that are working the COVID vaccine clinic at Bur-Mil, since a few things are working a little bit differently than they normally do for special events. We just figured this was a quick and easy way to make that as smooth a process as possible. So for getting there, for anyone that hasn't been to Bur-Mil Park before, it's one long road that goes in past the pool and the driving range. It will eventually jog to the right, and right in front of you will be the clubhouse where the clinic is located. The actual street address is 5834 Bur-Mil Club Road, and you will be reporting directly to the location. The current plan is to have you on site from 8:30 to 4:30, but there's some chance that will change. Also, like I mentioned, all equipment will already be on site. So as you're coming in on Bur-Mil Club Road that I'd mentioned, you will go past the driving range on your left, and then there'll be a big parking lot where you will stash your vehicle. You can then walk over to the clinic that will be located up and to your left. Also, that big turnaround in front of the building is where you would meet a unit if necessary. We'll cover that a little bit later in the slideshow. So upon arrival, you should check in with the Public Health EMS Liaison. There's a good chance that will either be Latanya or Vonda from Public Health, but there's some chance that will change as staffing needs fluctuate. Also, you're going to retrieve and check your equipment, which is stored in the training room, which is room 105. It's located as you enter the building to your left and then on the left. In terms of equipment that we'll have there will be a Med1 bag, a monitor, O2, suction, your radio, a tablet, a stair chair, and a stretcher. Also, you should call in as SE1 or Special Event Medic 1, and when you grab your radio, please check 1041 with Guilford Metro on main dispatch. In terms of PPE expectations, we're operating under normal Guilford EMS protocols. This shouldn't be an aerosolizing procedure, so a surgical mask covering both your mouth and nose is sufficient as long as you're not involved in specific patient care that would dictate otherwise. You're not required to wear safety glasses. They're optional up until the point that you are involved in patient care, and then they're required, and you would only need an N95 for aerosolizing procedures. The hope is that shouldn't be an issue at all. I think that the likelihood of patient care is really low at this event, but we want to be prepared just on the off chance that takes place. So for normal operations, you're going to be located in the vaccine area, which as you enter the building will be all the way on your right. There are 5 stations there where vaccines will be given by public health nurses. You'll be under the first aid sign in the vaccination room, and you're just expected to monitor subjects during their 15-minute holding period immediately post-vaccine. We've got 2 areas where that happens. You're going to be within sight of both of them. As you can see, there's a pretty decent number of chairs there. Our goal is to, once we get really up and running, have about 250 people through there per day. So you'll have a good flow of people through, but the expectation and likelihood that you would need to make patient contact is pretty low. So in the event of an incident, as soon as possible, we're asking that you move the patient from the vaccine area to the treatment area, which is located in the Guilford room. That is directly across from where you've picked up your equipment. We're going to have a wheelchair in the vaccine area so you can most efficiently move the patient to the EMS treatment area. We are asking that you complete an EPCR on all patient contacts, and you should be listed as the primary unit in both CAD and that EPCR. You would be listed as MSE1. We also, because we are tracking all incidents related to the vaccine, we ask that you inform the Public Health EMS Liaison that there's something going on. I imagine that if there's something where you need to get involved, everything else going on will grind to a pretty immediate halt and have everyone's attention. In the case where you are delivering patient care, one of the vaccination stations will be shut down, and that public health nurse will assume the monitoring duties while you are involved with the patient. Here are a couple photos of the Guilford room. As I mentioned, that is located across the hall from room 105, which is where your first stop is. Also, pay special attention to that door on the right-hand photo with the exit sign above it. That's going to be the way that you move patients out of the room in case they are being transported. So if transport is necessary, you would come out that door that you see now on the left. That's the exterior version of that. You would go down the patio and then down that ramp and around the left side of the building. I've got an aerial view of that to help you kind of orient here in just a second. Also, Guilford Metro has been informed that this is going on, and per their protocol, would not be sending Medic 1 or Greensboro Fire to you unless you specifically request them. And we expect that you should have a lot of hands there to help out in case you need it, but if you do need additional response, just go ahead and ask for that specifically. So there's that aerial view of the building. The EMS room is located there about the middle of the structure on the back side. You'd come down the ramp and come around and meet the unit. Inside the circle there is a portico there that they cannot drive under, but there's enough room to navigate around it so they can make a pretty quick exit. In terms of the end of the shift, we're asking that you return all the equipment back to room 105 and charge the radio. We would have you call 1042 with Guilford Metro on main dispatch, and then you just check out with the liaison who you've been interfacing with throughout the day. Thanks so much for your help with this. We're glad to have some additional assistance. We're hopeful that we wouldn't need you at all, but we appreciate you coming out and helping with the process. Thanks so much.